Welcome back to the third hour of our show. Thom Hartmann here with you. Congressman Wamp, I think it's actually Wamp is how he pronounces it, or he would prefer that it's pronounced W-A-M-P, the Republican Zack Wamp, the Republican from Tennessee, going on MSNBC today to talk about health care. This is the point that when Ted Kennedy at the Democratic National Convention in Denver said health care in the United States should be a right, not a privilege, he spoke the absolute, ultimate, and most important truth with regard to the whole health care debate in this country. And that is that if the Declaration of Independence, one of the founding documents of this country, although not one of the legal documents, but certainly the founding document of this country, says life, liberty, and the pursuit of happiness, that's why we're creating this government, that's what this is all about. And if the Constitution in the preamble speaks of the general welfare, and that is a legal document, that is not just a defining document, but a legal one as well. If they lay that out, if the founders laid that out, how can you have life? How can you have the general welfare be fulfilled if you have people who are sick and dying of that sickness, particularly if they're contagious sicknesses? But even at the individual level, what's the morality of this? Zack Wamp on MSNBC. Here, you got to hear this interchange. This is mind-boggling.
Listen, health care is a privilege. I do think that in some populations...
Well, it's a privilege, health care? I mean, if you have cancer right now, do you see it as a privilege to get some treatment?
I was just about to finish to say that for some people it's a right, but for everyone, frankly, it's not necessarily a right. Some people choose not to pay.
What people is it a right for?
So, and on it goes like that. But, I mean, this is the Republican mantra. And that, you know, for the Republicans in Congress who have very nice health care programs, thank you very much. It's a right, of course. And his whole pitch was, well, you know, some people choose not to have their employers deduct that couple $100 a month out of their paycheck because they want to keep the money. And for them, it's a privilege, not a... Give me a break. Health care is part of the commons. Health care is part of what we're all about in this country. You can't, if you want to have a right to life movement, you need to have a right to health care movement, because that is the ultimate right to life. I'm just boggled by this. I saw this in the news, and it's just like, you know, how can these Republicans, and we have been putting up with this stuff for how many years has it been? Since 1947. This is 2009. Was it 62 years, if I'm doing my math right? 62 years? In 1947, Harry Truman, President Harry Truman, proposed a national single-payer health care plan. Said, we're going to have Medicare for all. It wasn't even called Medicare back then. I think that, you know, Lyndon Johnson got that one going. But we're going to have a national single-payer health care plan, and you know who shot it down? The Republicans who had taken control of the House and Senate in the election of 46. They would not even allow the legislation to come to the floor for a vote. They shot that thing down. And you know, Dwight Eisenhower, the Republican, thought it would probably be a good idea, but he wasn't going to take on his own party on this thing. Jack Kennedy talked about it, never did anything. Lyndon Johnson tried to get it to be part of the Great Society. The closest he could get was Medicaid and Medicare, and have it be means tested. Oh, it's only for poor people. Then it's called welfare, and then, of course, you know, during good times, the Meat Act comes out. We're going to reform welfare as we know it. We're going to do away with welfare as we know it. Come on. This is not welfare. This is we the people. This is the right of Americans to life, liberty, and the pursuit of happiness. The reason I mention this is because as we speak, Barack Obama, well, I'm not sure if it's as we speak, but today, Barack Obama is having his meeting on health care. And many of us were very concerned. I did not go off on this in quite the way that perhaps I should have. I've been going as far as I can on this program to give the Obama administration every benefit of the doubt, realizing that they have inherited probably one of the worst disasters that any president has inherited since Abraham Lincoln came into office. I mean, just an absolute disaster from our standing around the world to 2 wars in the Middle East that we never have gotten into either one of them in the first place, to an economic meltdown that's the consequence of 28 years of insane economic policies by both Republicans and Democrats, initiated by Republicans, but there's a number of Democrats in there drinking the Kool-Aid. And my concern, as I've said, is that Barack Obama, President Obama, was basically saying, by selecting Kansas Governor Kathleen Sebelius as his HHS secretary and Nancy Ann DeParle as his advisor, his in-house chief advisor on health insurance. This is a woman, by the way, who, after she left the Medicare department, became a director for a bunch of different for-profit healthcare corporations, including Medco Health Solutions, Cerner, Boston Scientific, DaVita, and Triad Hospitals. And it really concerned me. And they were putting together this thing, and God bless Tim Carpenter and the folks at Progressive Democrats of America, pdamerica.com, or .org rather, that they got out there and they mobilized people to say, get somebody who represents single-payer health care at that meeting. And finally, as a consequence of all the pressure, frankly, that I think PDA and others, but they were certainly at the forefront of this, put on this, and Physicians for National Healthcare Program, pnhp.org. I mean, there's a bunch of good groups who really, really went to the mat on this thing. And as a consequence of that, Barack Obama has invited Congressman John Conyers, who is the author of single-payer health care legislation, very similar to what President Truman proposed in 1947, has invited John Conyers to that meeting. And so I think letting the president know, you can call the White House. The phone number's out there. It's easy enough to Google. And we're going to have to get that up on our website. We're going to have to revive our callcongress.org. I need to put that on my list of things to do here. That people can, that you can contact the White House and say, President Obama, we've got your back. Don't be afraid of these Republicans. Let them go off all they want about, health care is not a right, it's a privilege. Yes, it's a privilege. If you've got enough money, it's a privilege. It's your privilege, yes, but it's not a right. No, it's a privilege.
I was just about to finish to say that for some people it's a right, but for everyone, frankly, it's not necessarily a right. Some people choose not to pay.
Yeah, it's just a privilege. No, it's come on. So, anyhow, thank Barack Obama for that, and let your member of Congress know that we need a national single-payer health care program. The insurance companies in this country, and it, frankly, as I said, it concerns me greatly that HHS is now being populated by people who are insurance industry friendly. The insurance industry in this country is a massive, multi-billion-dollar, incredibly wealthy, incredibly powerful industry that, in my opinion, does not deserve to exist in its current form. Now, I got no problem with there being insurance companies that insure above and beyond the baseline, a basic Medicare program that covers everybody in the country, that will deal with any and all illnesses and will deal with them appropriately. But, hey, if somebody wants to buy if somebody living in Beverly Hills wants to buy an insurance policy that'll cover a boob job, I got no problem with that. If they want to buy an insurance policy that'll cover them if they're traveling in the third world or something like that, I got no problem with that. If there are a lot of niches, there are a lot of specialty niches that insurance companies, particularly for the very wealthy, that insurance companies could fill, as they do in countries with single-payer health care programs or national comprehensive health care programs. Let them reinvent themselves as such. They're going to become 1/10 the size that they are today. But, doesn't mean that they have to go. I'm not suggesting that they should be banned by law. But let's let every American buy into Medicare, or let's just simply create a national health insurance program and pay for it with taxes and let our taxes go up a little bit, because the bottom line is our costs are going to go down. As an entire nation right now, we're spending about $2.4 trillion a year on health care. And if we were doing it without the health insurance companies in the middle, it would only cost us somewhere between $1.5 and $1.75 trillion a year. And that's at current, with all the wonderful programs we've got. And doing it a little more rationally, we could probably get it down to 1.5. So people, instead of going to a $600 ER visit because their kid has got a really bad ear infection, they can make a $35 doctor visit. because they can go to the ER for free right now. I mean, you know how distorted and weird and whacked out this system is because it's a private for-profit system. Let's get the profit out of it. Let's get the for-profit hospital. Let's say if you want to run a hospital, you got to be a not-for-profit corporation. And you can't pay your CEO more than 20 times what your janitor makes. Nobody's getting rich in this business. You want to go into medicine, you go into it because you want to heal people. There is no shortage of people who have that calling. They are working in all over the world. Every industrialized country in the world has a national health care program, and they're doing just fine.